So David, great to have you here, and thank you so much for joining us for this first webinar. Maybe let me start with, you currently chair the WHO's external advisory group that supports obviously risk assessment of infectious hazards for the emergency program. I saw today that the WHO released a statement saying that the virus is accelerating. Can you give us a sense of what that actually means and what can we expect to see globally?
Well, what that means is that the virus has already spread pretty much throughout the world. And it means that countries are not having success in containing it and stopping it from transmitting within countries. Some countries in Asia have had better luck than other countries, but all countries that have had initial good luck in containing the virus are seeing it gradually increase, whether it's Singapore, whether it's South Korea, Germany, or the United Kingdom.
Thank you. And I also saw today that China has started to reduce its restrictions. People are starting to go back to work. One of our members have also just asked the question of how can it be possible that China has a population of 1.3 billion and it's starting to show no further infections? Is this really possible? Can you really constrain it to a single area? What would you expect to see from China over the coming days and weeks?
Well, this is a new virus. It's a new virus that has entered human populations. And the problem when a virus enters humans is it's not known what its final destiny will be. What we've seen now is that it causes discrete outbreaks and then spreads out into the community in countries where it enters. It enters by an international traveler or by some other means and then causes outbreaks. What we've seen in China is that they've clamped down on this outbreak from the top down, trying to stop transmission in Hubei and in other sites around China where the outbreaks have occurred. They've had success in interrupting transmission at some of those sites out of Hubei, and they have a very low level of transmission in Hubei. And it's true that the number of cases that have been reported from China is very small compared to the absolute population of the country. So the question remains, what is the real potential of this virus once the restrictions will be lifted?
And what do you think that could look like with the restrictions being lifted? I mean, there's a lot of discussion today around, has China moved too soon? Are they moving too soon just because they need to kickstart their economy? What would your take be on this?
Well, my take is that the Chinese are lifting very slowly areas that they want people to go back to work in or other things, and therefore they're going slow enough to clamp down again if they need to rapidly. But for the moment, it appears that they are going very slowly with a risk assessment beforehand to see what the numbers of people who were infected in the various sectors were and how they can best lift those sanctions.
Thank you. We discussed over the last couple of webinars just the impact that the virus is going to have on sort of low and middle income countries. Obviously, this is an area the WHO focuses a lot on in terms of making sure those most in need have access to everything that they need access to. So, I mean, from the WHO's perspective, what does that scale of the need look like? Which areas of the world are being most affected and really need development support and aid?
Well, all countries need support in some way or another. And certainly countries in Africa require quite a bit of support from WHO, technical support, and then financial support from donors like the United Kingdom and other countries. They need that in order that they can best determine where the virus is and what the impact is. Fortunately, Africa in general has a younger population than most other continents. And younger people are, we believe, less affected by the infection than are the elderly, and especially the elderly who have comorbidities such as diabetes or heart disease or hypertension. So we're hoping to see a different epidemiology in Africa, one that will not be quite as virulent as it has been in other parts of the world.
And in terms of the size of the packages that development will have to look like, what are the, I guess, equipment and organization and strategy that's needed to deliver things to the people on the ground? I saw that Jack Ma today from Alibaba delivered a huge crate of goods into Ethiopia to support with the outbreak there. What would this actually look like in terms of the international community responding?
Well, what's required is strong laboratory support in Africa that can diagnose cases, good surveillance systems that can detect cases, and a whole series of other things that will help Africans maintain those people who become sick, manage them in the right way. That is already started. The Africa Center for Disease Control, based in Addis Ababa, and the WHO regional office based in Brazzaville, have been working together to strengthen laboratory capacity in countries. And so every country in Africa now does have the capacity it needs to diagnose infections. So that's a step forward. And countries are at the same time beginning to develop the surveillance systems they need to detect where infections are occurring. Likely, most often, they'll be looking in populations in the capital cities where imported cases could occur first, and maybe in populations such as health workers, when they get an influenza-like illness, they may want to test them with the PCR technologies, which have now been scattered throughout Africa.
And in terms of Latin America, we've seen very little information about what's happening on that side of the world and on that continent. What are there things that we should be knowing about? What are the cases, and what is the trajectory looking like there?
Well, Latin America is not away from the threat. The threat is there. And already some countries such as Chile and other countries are seeing a surge in patients, mainly from increased travel, people coming in with infections, people who have gone out of the country for holiday, or people who are coming in from areas where there's infection. So this, like all infectious diseases, is spreading around the world by people who take it from one continent to another.
We've seen in the UK that they're starting the first sort of treatments against COVID-19 to see if they will work. What promise does that look like?
Well, it's very important that clinical trials be done on existing drugs. And drugs have all been studied in the laboratory, and some will be repurposed now to be entering into clinical trials to see if they're effective. Such things as chloroquine will be tested. Chloroquine in combination maybe with an antibiotic such as azithromycin will be tested in case control studies comparing a group treated to a group not treated. And there's a very great interest in antibodies also, either in monoclonal antibodies that can be produced in a laboratory, or antibodies that come from the blood, the serum of those who have survived, seeing if that can any way modify infection or prevent infection in those who have been in contact. But above all, whatever is found must be used very early in infection, because later in infection they will have no effect no matter what the drug is.
And in the news today as well, Sweden is getting a lot of comments about their lack of significant response to the crisis. They're obviously going with the principle of a sort of herd immunity. Is that really discredited now? Is that something that is still possible and could be a successful way to mitigate this crisis?
Well, every country does a risk assessment based on what it knows about its own country, its capacities, and also what it knows about the risk populations in their country, who's at risk, and how they can best deal with this outbreak with the capacities that they have. I'm not familiar with what Sweden has done completely. I'm not completely aware of what they've done. But if they've decided to stock up their hospitals with ventilators and make sure that they can meet a surge of patients that might come, and are doing other measures such as testing and making sure that they know when patients come in, that may be the strategy that they feel they can do best. And what we're seeing is every country is doing a little bit different in its strategy. And some are top-down approaches, others are bottom-up approaches. And really, the jury's out about which one will be most effective. What we need to do is countries need to do their risk assessment and operate within their capacities and their customs.
Great. And moving to questions, is it right that 20% of infected people will need hospitalization in the UK? And if so, will we have a higher death rate because of the lack of capacity of our health system relative to countries where death rate has been calculated, if that makes sense?
Well, it wouldn't be fair for me to predict what will happen in the UK. What I can say is that there have been estimates that 20% of the population will need hospitalization, and even more will, and a certain fraction of that, will need intensive care and eventually ventilation. So that's clear that there will be patients. The UK strategy is to try to equalize the surge of patients so that they come in a regular way and not all at one time. And I know that the UK has made an arrangement with private hospitals as well to have extra room capacity and also extra ventilator capacity. So each country prepares itself based on what it can do best and based on its resources.
And I mean, I guess building off that, why isn't the approach, especially in the UK, to test more widely? It does seem insane to a lot of people that people are only being tested whilst they're already in critical condition. You know, in the UK, they're being asked to stay at home for 7 days. Should we be testing more prolifically? And if so, again, does this go back to your assessment and capacity point?
Again, that's an assessment done by national experts who decide what to do. The UK is using a policy which has been very helpful actually in many Asian countries, where people are being greatly educated about how they can prevent themselves from becoming infected by doing such things as physical distancing and making sure that they're not in the way of infection, and also making sure that they wash their hands should they have touched a surface which is contaminated from a cough by someone who's sick. At the same time, they're telling people how to protect others by being sure that they take special care when they're with the elderly, whether the elderly are in nursing homes or whether they're in their own homes, to be careful with them. And there's a whole group of volunteers who are developing within the United Kingdom, as UK does very well, in making sure that there will be supplies that are necessary for people in their homes. The elderly, again, are at the greatest risk. And the government, as you know, has singled out 1,500 or 1.5 million of those who are at greatest risk, and they will be receiving information from the NHS as to how to protect themselves.
What in your view, is the most likely trajectory in the UK? Are we going to be social distancing into late 2020, early 2021 until a vaccine is widely available? Or do you think the UK might be able to move more towards the Chinese model sooner?
You know, it's not possible to predict what will happen with this virus. The modelers, when they predict, use a figure that we still don't understand completely. And that's the figure on transmissibility, the R0, many people call it, the reproductive number. And we don't exactly understand the entire transmissibility of this virus. So it would be wrong for me to make an estimate. Modelers are making estimates based on the best possible information they have. But it's also wrong to say, well, we'll just wait until there's a vaccine, because there may not be a vaccine. You know, there's work going on to develop a vaccine now. That vaccine has to be shown to be safe and shown to be effective and create an immunity which lasts and which can protect people against infection. A big order, a tall order for a vaccine. And so vaccine research is healthy and underway, especially supported by CEPI, which is the Coalition for Epidemic Preparedness and Innovation, which is based in London and Norway. And that coalition has over 30 different trials underway by the biotechs. Once the biotechs have developed a vaccine and put it through animal safety testing and effectiveness testing, and then into humans doing the same thing, it will be sometime at the end of this year or next year. Then licensing must be undertaken. And then at the same time, there must be a producer who's willing to produce the vaccine in quantities enough for people throughout the world. All those things are going on in parallel now to a certain extent, and hopefully there will be a vaccine. Hopefully it will be available, but it's wrong to say we'll wait for a vaccine. Everybody needs to know how they can prevent themselves from being infected and prevent others from getting infected from them should they become sick. And that's the key to outbreak containment and success.
There was a lot of criticism today about how many people were outside in the UK, in parks, you know, beaches, other public places. What is the airborne risk of spreading the virus? And will a rise in humidity and warm weather make an impact on its transmission?
Well, first of all, the recommendations of the UK are to maintain a distance of about a meter or more, a little more than a meter between people. So if people are out exercising and they're at a meter or a meter and a half away from others, they're probably in a safe condition. The disease is not spread by aerosols, which are fine mist. They're by droplets, which are more heavy than a mist. And these droplets can infect persons if you're coughed upon directly, or if there's coughing, say, on the ground and you're laying down to do push-ups on the ground or something to that effect. So you must keep your hands clean after you do your exercises and keep them away from your face at all times. So there are things that everybody needs to do to prevent themselves from being infected. So the rules in the UK do permit people to do exercise, but you just need to be careful and understand how this virus is transmitted. Make sure your hands and your body remain free of virus.
How useful do you think the diamond ship cruise studies are in terms of them being a bit of a denominator for a total population? Are there any other examples of this, and what do you make of them?
Well, they're quite useful, but the Diamond Princess was a closed environment. And the initial results of the study suggest that there were people who were on the crew that were working in the kitchen or distributing meals to the people who were in isolation, who were actually infected and were maybe coughing on the food or coughing in some way that the people who received the food were contaminated. This was a good natural laboratory to understand transmission dynamics, but it's not what occurs in an open situation where people are in the community. So what we believe is that there are initially clusters of infection, such as occur when people are in close proximity, church gatherings, for example, in South Korea or other places. And then those people who become infected send off in all directions chains of transmission among their contacts. And that's how the disease spreads into the community.
From what you know, do you believe that treatment has a better chance of being effective in an individual patient if they can be tested at the very first signs of illness?
If people are tested early in their infection and found to be infected and provided with treatment, it has a greater success of being an effective treatment than if it's given later in the infection. It's the same with influenza. It's the same with many viral infections. Treat early rather than waiting till the damage has been done.
Do you know yet what proportion of deaths related to the coronavirus are kind of extra, for want of a better word, above the sort of expected baseline mortality?
No, we don't yet know that. We know that mortality can be quite high in localized areas. We know that there's been a high level of mortality in Italy, for example. What we don't have is the denominator of all the people who have been infected. We do know that the high mortality in Italy is due to two different things. The age pyramid of the population. There are many, many more people elderly than in many other countries. In fact, I think it's about 23% over the age of 60 in Italy. And the outbreak occurred in an area where there were many elderly people living. That's where it first began. And the second thing is that Italy's hospitals were not prepared for the surge of patients they had, and therefore weren't able to offer ventilators to all the people who needed them. And many people, unfortunately, died from the infection.
And there's been a lot of different information in terms of how long the virus could last on different surfaces, whether that's plastic, whether that's more sort of kitchen surfaces. What is the information that we should be taking into our heads, and how should we be making precautions about that in our home and with the things that we're touching?
Well, some of the current studies suggest that it could stay alive in plastic surfaces for up to a couple days. And it's not really clear at this point how long it can stay. But what the best thing to do is to wash hands whenever you come in from outdoors, and to make sure that surfaces in the house are cleaned down regularly if there's someone in the house who's coughing or sneezing, has a fever, and might have the infection. So regular good hygiene in homes, especially hygiene when there are people coughing and sneezing, making sure that areas where they are cleaned up regularly, and making sure that hand washing is a part of the ritual in managing patients or in dealing with patients is very important, as well as physical distancing. And that patient could also wear a mask to prevent the cough and sneeze from contaminating surfaces or other people.
For people with very young children who are obviously struggling with both working from home and also taking care of their children whilst nurseries are closed, schools are closed, how reasonable is it to think about bringing in a nanny or one individual person into the home for a couple of hours per day to sort of help out, given that if you are still following the sort of rules that you've applied and the social distancing rules, are you putting people at risk at that point, or is that an acceptable thing to be thinking about doing?
Well, we don't understand all the transmission dynamics of the infection. We don't understand if people who are asymptomatic can transmit the infection to others. What we believe most people believe is that the day before the onset of signs and symptoms, a person could be able to transmit if they cough or if they speak and droplets land on someone's face or in the environment. So the day before the onset of symptoms might be a day when they can transmit. So based on that risk analysis, it might be that people could have people come in to help them at home for a period of time when they're not, if they haven't been exposed to anyone who's been sick, and if they themselves are in good shape. And so that should be some of the questions that are asked every day before a nanny or a worker comes into the home. Have you been exposed to somebody in the last 12 hours who was coughing or sneezing or had a fever? And have you yourself had any of those signs and symptoms? So that's one way that a person could do a risk evaluation before they accept a worker to come into the home. But this will vary on the risk tolerance of various people. But it's still a very difficult situation for people to decide upon. It's very difficult for mothers who are attempting to telework from home when they don't have support.
You covered this a little bit earlier, but I'll probe a little further. How difficult do you think it will be, and how long do you think it will take to increase testing capacity in the UK so that most people with symptoms could be tested early instead of limiting it to the hospitalized patients that we see now?
Well, there are new testing capacities available. You can do, for example, what's called high throughput testing by putting a series of samples in an automated machine that does many, many samples each hour. So there are new automated ways that are being developed, and these can simplify testing and also make it more targeted in certain situations. At the same time, there are some antibody tests which are coming on board as well. And these tests, once they've been validated to be highly specific, can be used to determine whether someone in the past has had infection. And so if, for example, you have a nanny who's working with you, and you could test to see whether or not in the past that person has had infection, that might be one way of seeing whether or not that person is safe in your household. So there are all types of possibilities with testing, but the testing policies will be determined by the government or by a private sector, which is offering that. And then people will be able to decide whether or not they want that testing to be done. But government makes those decisions.
Thank you. In terms of, I guess, looking forward and thinking about the kind of future of healthcare and the investment that's needed to go into looking at these sort of viruses coming back into our spaces again. Obviously, one of your roles previously was to head up the global response to SARS. In terms of what you would like to see governments and businesses really do to make sure they prepare for the future, what would that actually look like?
Well, I think governments and the private sector need to work closer together in planning such things as shutting down factories, in planning all kinds of different activities so that there's harmony between the two. I don't know how much of that goes on today. I know the World Economic Forum is working with industry, trying to get them to work together to have a strategy and a policy on how they will react when pandemics such as this occur. But there's lots of room for improvement so that everybody's working together to do the right thing at the right time. And when governments begin to put people back to work or say it's safe for people to go back to work, then industry will be very important in making sure that they have the way of determining whether that decision has been the right decision or whether there are people coming to work who are infected and who infect others at the workplace. So it's got to be a joint activity between governments and the private sector to really understand how to best proceed in this outbreak, in this pandemic, and in future.
And one final question, what are the likely implications for refugees around the world as the virus spreads?
Well, the difficulty is going to be both for refugees and also for foreign workers in countries such as countries in the Middle East. They are sometimes in a no man's land and nobody's really looking out for them or dealing with them. And this will have to be taken on by the UN High Commission for Refugees and others. And I know the Red Cross, the Red Crescent Societies, and others are discussing how they can best provide support to these people who really live in no man's land, who live in a country that's not theirs and are sometimes neglected by that country. the international norm is that the country in which these people are living should be taking care of their health needs. Whether that happens is at the discretion of the country, and oftentimes it doesn't happen. And so there has to be, the UN and the UN High Commission need to be working to make sure that there is support for these people as well.
Great. Thank you so much for your time this evening, David. I think we managed to get through a record number of questions as well from the community. So thank you everyone for being so active. David will be back with us on Thursday for the COVID briefing. Tomorrow, Peter Droback will join us again. So please dial in to hear the updates from our experts in residence and share your questions and get them answered. So thank you so much for your time this evening, David. Thank you everybody who joined, and wishing you all a great evening.
And thanks to you.
Thanks, bye.